Hello and welcome to Physician Spotlight. I am your host, Dr. Vikram Christian. Physician Spotlight is a forum for us to learn more about our rising stars and leaders in the field of nutrition. We are very grateful to ASPEN and our viewers for making this possible. On today's episode, I have the privilege of interviewing Dr. Catherine Larson-Nath, a pediatric gastroenterologist. She is the director of the Intestinal Rehabilitation Program and the director of the Pediatric GI, Hepatology, and Nutrition Fellowship Program at the University of Minnesota. Dr. Larson-Nath is an assistant, soon-to-be associate professor here at the University of Minnesota. She is also has multiple roles within ASPEN, including the associate editorship at the NCP Journal. And more than that, she is my friend and colleague also at the University of Minnesota. Thank you for joining me today, Katie.
Yeah. Oh, thanks, Vikram. I'm so excited to be here. It's a pleasure to be invited to do this and really an honor.
Katie, I was wondering if you could start off by just telling the audience a little bit about yourself.
Yeah, so I think you did a great introduction there. But yep, I am an assistant, I guess, soon to be associate professor at the University of Minnesota, and have been practicing out of my fellowship for 7.5 years now, and really enjoy what I do, and have been fortunate to be able to make nutrition a part of my career and really focus my career on that. And so ASPEN's been an integral part of that in addition to the support from my institution.
Okay. At what point do you feel like you decided that nutrition was going to be a part of your career?
Looking back, it really, I think, is in med school. I was on a pediatric GI rotation and had a patient with short bowel syndrome, complex anatomy, and it just really intrigued me. And I became very interested in it. And then I'm one of those kind of crazy people who liked writing TPN in the NICU. And so those things put together, and it really is like, oh, wow, there's actually a field I can go into, and it doesn't hurt that Peds GI also does procedures, and I like procedures as well. So that really was in med school, I think. And that one, I really can think of that one patient that really inspired me and allowed me to connect things together.
Okay. And I know you did your fellowship training in Peds GI at the Medical College of Wisconsin, where I did my training as well. Tell me, Katie, how do you feel like you tailored your fellowship training for that career in nutrition that you're looking to?
I think that's a really important question, because if you are a pediatric gastroenterologist and training in that, not every center is going to have the same exposure to nutrition. And I knew that with Dr. Gaudet at MCW at the time, that I would get that exposure. And some people do go on and do a 4th-year fellowship, which I think is also very reasonable. It just depends on the course that you go. But that was one of the reasons I left the University of Minnesota for fellowship, was because I knew what I wanted to do and knew that getting training at a center that had someone with expertise in that would be very helpful. And that really came true. I still remember, I think it was during 2nd-year fellowship, there was an opportunity for some weekend in Chicago where a bunch of I think it was mostly fellows, and there were a lot of adult ICU fellows, I remember, and surgery fellows, and some pediatric people, and even a veterinarian came and just learned on nutrition topics. This was all supported by ASPEN.
Wow.
And and it was a great weekend. I learned a lot, and it just really made me more enthusiastic about the field I was going into. And then there was an opportunity after that to have a little bit more support to go to the annual meeting in Savannah that year. And so I was fortunate enough to be selected to go there and be sponsored to go to the meeting through that program, and had some more mentorship through that. And really, that's kind of where it all started, and things have blossomed, I would say, from that.
Wow, that's awesome. Thanks for sharing that. So obviously, ASPEN, it sounds like it's been a big part of your life, and I know that you've been very active within ASPEN as well. Can you tell us a little bit more about what your activity within ASPEN has been through the years?
ASPEN provides so many opportunities for everyone involved with nutrition support at different disciplines. So I think one of my first, outside of those early on mentorship kind of things, one of my first things I was involved with was I was a member of the CNSC Exam committee, and really getting to partake and help advocate for the PEDS questions and make sure we're doing a good test that reflects what's needed to be a nutrition support clinician. I've also then had the opportunity to help with the meeting planning committee for the meetings, well, the virtual meetings a couple of years ago, and then last year's Seattle meeting, which was exciting and just great. And then also being involved in the EPD and the CPC committees as well. So lots of different opportunities.
Excellent. You mentioned the CNSC exam committee, and I've taken the CNSC exam myself. And tell us a little bit more about the CNSC examination for people who are not familiar, and I guess just the role that having that certification plays.
Yeah, so I think the CNSC is really an important tool to show that you have the basic knowledge to provide nutrition support. And what makes it unique is that it's not for just one discipline. So it's not just for physicians. It is for physicians, for dietitians, for pharmacists, for nurses, for advanced practice providers, everyone who is part of the nutrition support team. And it just demonstrates how multidisciplinary the provision of nutrition care for patients is.
Yeah. You mentioned multidisciplinary care, and I think that's totally what nutrition is. Definitely a team sport, and I know that you practice that sport here at our hospital in the CVICU and the NICU rounds. I know you do some nutrition focused rounds there. Tell me a little bit more about what you do and what that experience has been like for you.
Yeah, so it's unique. It's a little bit different from a standard, I think, or what people think about a traditional nutrition support team. And we do have that as well. But this is where I, as a pediatric gastroenterologist, actually go into our neonatal intensive care unit and into our cardiac IC unit and actually spend rounds time with the teams there. So I'm standing there on rounds as we're discussing patients and can really help bring forth the importance of nutrition care and provide some troubleshooting as well. And I think it's been a unique experience. And I think it's been helpful because there's also that continuity of care that sometimes when you just do traditional consults, the patients don't get. So the families know who I am, and then I will see them in an outpatient, whereas many of these providers end up who are inpatient, they're inpatient only, especially in the intensive care setting. And so they don't have that continuity. So I think it's helpful in many respects.
For sure. And I know that there's a special term which is given to that day. Do you want to share that?
Yes, the special term. Yes, it's called Wait Wednesdays in our cardiac ICU. So I round on Wednesday mornings in our cardiac ICU and come in. I walk into the unit and everyone goes, "Oh, it's Wednesday. It's Wait Wednesday."
And I think that's great. I think it's always it's a good reminder to, maybe multiple things going on. Obviously in the ICU, it's good to have that reminder to think about nutrition specifically and intentionally. That's great. Katie, you mentioned a little bit about, focusing on nutrition in these settings. And I know that that's a research interest for you as well. Tell me a little bit more about that, what you're working on and what you've learned, if you don't mind sharing.
Oh, for sure. So one thing I think we all run into is we all know that's important to understand how someone's growing, especially in pediatrics, but where their weight is, but then also body composition is very appropriate. And when you have critically ill patients, it can be very difficult to understand what their body composition really is. How much of what we're putting on, is it fat? Is it muscle? Is it fluid? And so I'm trying to use bedside techniques like ultrasound to see if we can longitudinally assess the impact of our nutrition support interventions for patients who are critically ill.
Interesting. And you mentioned some of the activity that you've had within ASPEN. Can you share a little bit more about what you're doing right now within ASPEN?
Yeah, so I guess I was talking more about my past activities, but I have many things I'm doing now. I have the honor of being the president of the Clinical Practice Committee, which is great experience, and I think just a way to be involved with what kind of guidelines and recommendations and practice standards are coming from our society. And it's been so much fun to be able to read all of the interesting ideas that the different groups from ASPEN are coming forward with, that they want to make papers and recommendations and guidelines for, and then to help make those ideas better. I'm also associate editor for Nutrition and Clinical Practice, and which has been really fun as well. Again, it's more reading all the exciting work that people do and getting to help kind of disseminate that information. And I think one of the most exciting things is we are coming out with the third edition, which is essentially a new edition, fully rewrite of the Pediatric Nutrition Support Handbook, which hopefully, fingers crossed, will be available by the conference this year. This is our goal. Might be a little bit after that, but we will see. So more to
Exciting. That's
come. It's
awesome.
so much fun.
Very cool. It's very cool, Katie. Thanks for sharing that. So, obviously, Katie, it seems like, your career has definitely been focused towards nutrition, right from fellowship training, maybe even preceding that. Tell me, Katie, obviously you mentioned a little bit of Dr. Gooday and, his role, I think, in your career. Tell me a little bit about mentorship and the role that has had in your career.
Yeah, mentorship, it's, I think, very important. I think goes as a two-way street. And so for sure, Dr. Goudet has been an integral mentor for me and has provided me with a lot of opportunities, as he's very well known in ASPEN as well. And also just introduce me to other people who may be helpful. I think Dr. Earthman is another person that I've done some projects with. And it's through ASPEN and actually Dr. Goudet introducing us that we kind of were able to make those connections. And then I was able to work with some of her grad students when she was at the University of Minnesota. So it was actually through ASPEN and not the fact that we were at the same university that we really got connected. And so been able to help mentor some of her nutrition grad students, and then some other opportunities to mentor some international physicians as well through ASPEN. And it's been so wonderful to have these opportunities through a society that really encourages teamwork and building people up.
Yeah, and I think that's one thing that's so true about ASPEN. I feel like it's such a supportive network. I feel of such a multidisciplinary supportive network, and there's never a lack of mentorship. I feel within ASPEN. That's great.
Yeah.
Any words of wisdom, Katie, for I guess young faculties, trainees, people who are thinking about a career in nutrition? Any words of wisdom or advice?
Yeah, if you're interested in nutrition at all, just go for it. It's very much needed. And I think within ASPEN and people that you'll meet can help provide that support for you. If you're worried that maybe your hospital is not going to recognize what you're doing, just help give you ideas on the ways to make that happen and recognize that what you do is important. People are very friendly within our society. And I think just not being afraid to go talk with people and say, hey, I heard this, I'm wondering if I could chat with you about you're doing this interesting thing is really important. And I think whenever you are doing something that you enjoy, I know it sounds cliche, but becomes less work. It's more enjoyable. And so just remembering that.
For sure. I think, you said it, if you're interested in nutrition, go for it. I like that. Well, Katie, it's been an honor and privilege to chat with you and interview for this Physician Spotlight. Thank you so much for taking the time for this conversation. And thank you so much for ASPEN for making this possible.
Yes, thank you. It's been great. Thanks for inviting me.